Hi, everyone. Dr. Langston here. I just wanted to introduce Dr. Williams and thank him for taking his time to do this, just to give us some background on the COVID vaccine. There's so much swirling around out there, and it's really hard to know what to trust and what the facts are. And so this is just going to be Dr. Williams graciously offering to lay some of it out, the data, the science behind it, and so that you can have that information to make your own decisions, just to know kind of what's going on out there in our world right now. So Dr. Williams was very kind to volunteer to do this for us, and I'm really grateful for that. And this will be available on the shared drive, and everyone can watch it going forward. So we're going to really appreciate that. Dr. Williams, I'll turn it over to you.
Well, thanks a lot, Josh. It's really nice. For those of you that haven't met, I haven't met. My name is Mike Williams, and I work over in the Cancer Center. Been here for about 10 years and was a resident here before that. And this is just something that came up over my conversations with many of our staff over the last several months. Their concerns, and very valid concerns, about what's going on with the COVID-19 vaccine and whether or not it's something they should do. And so with that in mind, I kind of wanted to just present a lot of just factual information, just stuff that's out there, stuff you need to know about our area, where we're at, and kind of next things from there. So really the objectives, kind of setting up the problem, what is the deal with COVID-19, and then talking about specifically the 2 clinical trials that are out with respect to the 2 vaccines that are currently available. We'll also go over some common questions that I hear, as well as common questions that are addressed, and we'll do some Q&A at the end if there's any other further questions. The biggest thing that I want you to know is that practically everything on here comes straight from the CDC. There are, of course, the clinical trials we'll talk about, and there are a couple other articles that are on here that aren't from the CDC directly, but this is all stuff that's out there just as how this is really approved. So the problem, basically, this is a data set that goes all the way out to last week. And each one of these bar lines represents a single week in the history of COVID-19. The very first case was actually on Leap Day, 29 February of last year. And in the last week, we had about 92,000 new cases across the United States, which you can see is actually a downtick over where it had been before. If we look at it a different way in terms of the total numbers of cases, we see that unfortunately, since that first case in the 29th of February last year, we've had almost 27 million cases in the United States, which equates to about 8,200 cases per 100,000, or roughly 8.2% of the US population in total. But the more important thing, of course, is deaths, and deaths is really what's driving a lot of this. And as you can see, the very first death was about 5 days after the first diagnosis in March, 4 March of 20. And last week, we had about 1,400 new deaths, which is actually a downtick as compared to we were just about 3 weeks ago, where we were over 5,000 deaths for the second time in the history of this infection. And if we look at the total number of deaths, it's almost 500,000 now over the last 10 months. With about 139 deaths per 100,000 population, which equates to a really small percentage of the total US population, and about 2% of all the people that are diagnosed with COVID. So whenever we look at this, I kind of wanted to show you what's going on in our area. And so the things that we really want to look at, I'm going to highlight 2 areas here, numbers from the last 2 weeks, of course. The first one is called the percent positive, which basically means the number of people that get a test, how many of them have a positive test for COVID. And unfortunately, in my own town, Chesapeake, it's about 1 in 5, about 22%. And the other thing that's actually more important to me is kind of shows capacity, is really the number of ICU beds that are having to be utilized for COVID positive patients. And unfortunately, in our county, that number is almost 50%. If we look at Virginia Beach, they're a little bit better at 17% positive, but they still have about a quarter of their beds utilized for COVID. Norfolk's a little bit better at 16% and only 13% of their beds used for COVID. Suffolk, unfortunately, is the worst in the area. Though they only have about 16% positive, it's that 62% of ICU beds being taken over by COVID that really is making hospital capacity difficult. Portsmouth is similar at 19% and 30%. And Hampton has 21% versus 43% of their COVID ICU beds. So this really drives that point home about capacity. So really, whenever you're thinking about capacity, this is the number of beds that are having to be utilized for a given infection. And unfortunately, whenever you normally run a capacity at a hospital between 95 and 96% at all times, and then you unfortunately have an influx of several thousand patients through the area, it can overwhelm the healthcare system. And this is probably one of the main reasons that you saw a shutdown early on, was that there was just so much going on with COVID that you couldn't deliver basic healthcare. Couldn't have cancer cases in New York City, for example. You couldn't have any basic overall issues with dealing with cardiac disease. These are all things that make scary times in terms of healthcare delivery. But whenever you instituted these whole concepts of masking and social distancing, the numbers have actually dropped down and become a little bit more reasonable, except whenever people kind of get a little lax and you end up at Thanksgiving and Christmas. And unfortunately, a couple of weeks after each one of those, you saw a nice little surge in cases. So what is it about COVID that makes it so dangerous? Well, really, the very first thing, it's never been seen in the entire history of humans. So no one has immunity. You don't develop immunity until you become infected or had a vaccination. It's very different than what we see with measles or chickenpox, which already have vaccines or people have already been infected with those. And the other thing that makes this very dangerous is that though it does tend to affect more severely patients with significant comorbid illness, unfortunately, healthy people die of this disease. And we just don't have a real understanding as to why that is the case. There are also issues post-infection. So after you recover from COVID-19, you can have some common issues like fatigue, shortness of breath, cough, joint pain, chest pain. These are all things that can actually last for months. Other long-term issues include, cognitive disorders like brain fog, depression, muscle pain, headache, intermittent fevers, and palpitation. But there are some serious long-term complications. And you've probably heard this around the summertime when people are starting to look at starting up football again. Whenever several athletes were diagnosed with some myocarditis issues and basically had to stop playing football altogether because this could actually lead to sudden death. There are lung function abnormalities. As you might expect, after having pneumonia and having scar tissue develop, you may have difficulty breathing for a much longer period of time. There's acute kidney injuries. There's skin changes like rash and hair loss, and there's neurological changes. Some smell and taste issues are the most common one that everyone hears about, and those can last for months after the infection. There are some people have issues with sleep, difficulty with focus, and memory problems. And then finally, all of this can lead to further psychiatric complications like depression, anxiety, and mood changes. So then there's this promise of the vaccine. And vaccines have been successful in multiple different diseases, like the flu, where we get every single year, chickenpox, for example, the MMR vaccine that you get as a child, as well as for healthcare workers, hepatitis B, and for those that become infected with hepatitis C vaccines are there. But currently, there are two vaccines that are FDA approved, and we're going to talk about both of these, the Pfizer, BioNTech, and then Mederna. Now, I throw this up here only because I just read this morning and looked at basically why we're doing this talk. It's that a third of U.S. adults find it very skeptical of the COVID vaccine, and 17% of people say they will absolutely not get the vaccine, and 16% say probably not. And their primary concern was, hey, what about safety and efficacy? And I hope with going over these studies, you're going to see that these drugs are actually quite safe. So if we turn to the Pfizer BioNTech, which was the very first one on the market, this was published in late December of 2020, the phase 2/3 trial, and it was FDA approved in early December. Essentially, this looked at a drug where you gave a vaccine on day 1 and day 21, and then you followed these patients. And it looked at over 43,000 patients enrolled, in which half got placebo and half got vaccine. To put that into perspective, a large clinical trial in prostate cancer, for which I manage quite a bit of, the drugs that we use have a large trial of about 1,400 to 1,500 patients. So to have 44,000 patients is quite impressive overall. Now, the vaccine is an RNA, a messenger RNA that encodes your cell to develop the spike protein that is seen in actual COVID-19. So it kind of allows your immune system to see the shell of what's there. And the thing that I always like to tell people, it's kind of like having a car and you see the nice car on the outside, but you get in there and you try and start the car, but there's no engine. So there's no way you can actually get COVID-19 from the vaccine. This vaccine only develops a spike protein to allow your immune system to identify it and recognize it if you were to become infected with actual COVID-19. Then in terms of inclusion criteria, people had to be over the age of 16. They could be healthy or they could have stable chronic medical conditions in this particular trial. And that included HIV, hepatitis B, as well as hepatitis C. You could not be involved in this trial if you had a history of COVID-19 infection, or you were being treated with immunosuppressive therapy or diagnosed with an immunocompromising condition. And the rationale behind this is that if you don't really have enough of an immune system to build an immune response for a vaccine which requires it, it's not going to really help you at all. In terms of outcomes, the total number of cases out of 44,000 patients that had COVID-19 were 170. So that's a really small percentage of the population, but similar to what we see nationwide. Now, about 162 of the 170 patients that had COVID were in the placebo arm. So this was very, very successful at preventing infection. As a matter of fact, it was 95% effective overall. And interestingly, 82% effective after the first dose and 95% effective 7 days after the second dose. So you actually have a very good, comfortable yield at that time, very shortly after your first vaccine. There were common side effects. As you might expect, about 3/4 of patients had pain at the injection site. And interestingly, they broke it down that younger people had more pain than older people did. There was also some redness and swelling, as you might expect, and severe side effects, which was one that we would say you'd require going to the doctor for, being treated at a hospital for, were two things: fatigue and headache. And both of those were very small numbers. Now, if we turn our attention towards the newer vaccine called Mederna, this publication actually just came out last week, though it was approved in late December of 2020. In this particular trial, they were administered 28 days apart, and it looked at a little smaller population of about 30,000 patients, again, randomized half between placebo and half vaccine. It had a very similar design as to the Pfizer vaccine. It's a messenger RNA that encodes for this development of the spike protein. So again, it's looked at like the shell of the car without the driving engine behind it. And interestingly, in this trial, they enrolled 2% of patients that actually had COVID-19 at baseline. In terms of inclusion criteria, they allowed anyone over the age of 18 with or without a history of COVID infection, and they also enrolled patients that were susceptible to increased risk of developing COVID-19 complications, specifically that of chronic lung disease, significant cardiac disease, severe obesity, diabetes, whether it was type 1, type 2, or gestational, liver disease, as well as HIV infection. And their outcomes were very similar to the one of Pfizer, in that about 196 cases were identified out of that 130 or out of that 30,000 patients, and 185 of those cases, or the vast majority, were in the placebo arm. 95% effectiveness in preventing COVID-19, and it was very similar across all subgroups. So it didn't matter if you had chronic lung disease, you had significant heart disease, you had diabetes. They actually benefited from getting the vaccine and preventing infection. Interestingly, those that were diagnosed with severe COVID, which meant that you had to go to the hospital, be admitted, possibly on a ventilator, this only occurred in 30 patients out of the 30,000, and one of those resulted in a death, and all of these were in the placebo arm. So if we look at common side effects, again, 80 to 85% of patients with injection reaction, they normally lasted about 2 to 3 days after each injection. And there's a very unique thing in the Mederna vaccine that is called COVID arm. I'm going to show you a picture in a second. Is basically about 8 days after you got the injection, you developed a rash on your arm in that same location. And it normally went away after 4 to 5 days. Interestingly, it was actually most common in the first dosing and actually less common after you got the second dose. In terms of moderate to severe side effects, and most of these were moderate, it's about 50% of patients had these, and most started at 15 hours and resolved 48 hours later. And this was actually less than what you see with the zoster vaccine, or the one that prevents chickenpox. And this is just an example of what a COVID arm is. I've seen them even more raised and swollen than that. But again, it only occurred in about 0.8% of the population that was studied. So overall, both vaccines are effective in preventing COVID-19 infection. The reported follow-up for all of these is about 3 to 4 months. So we really don't have a long-term follow-up yet, but there have been people getting the vaccine since about the beginning of June on these trials. Of course, the plan is for a 2-year follow-up, and obviously they're going to continue to evaluate for efficacy as well as safety during that time. So what are the common questions that I get about this vaccine? You hear a lot about herd immunity, kind of a fancy little talk that everyone seems to give. Fauci gives a lot on this. You hear a lot about mutations and whether or not it's effective for those. We also hear a lot of questions about pregnancy and whether they should get it in pregnancy or if they're breastfeeding. There are other medical conditions that people are worried about and whether or not they should receive it for that. And then finally, the question everyone asks, is it mandatory at Urology of Virginia? Is this going to be mandatory? So let's talk about herd immunity. Well, when the average number of people is infected by a single person is less than or equal to 1, which means if that you've got COVID-19 and you walk into a room and there's 5 people and only one of those people or less get infected, this is actually herd immunity. That's when you've achieved it. And this is currently the case with drugs like, or with the diseases like measles and polio. This is because we have vaccines for these. In the case of COVID-19, the estimated number is anywhere between 60 and 90%. I think I read most recently with Fauci's data that this number is probably in the 85% range. And it's really going to be achieved by the number that need to have immunity from either a vaccination or a prior infection. And if we think about it as of right now, we have had 46 million people in the United States vaccinated, and we've had about 26 million people infected. So there is this, it's a significant chunk of the number of people in the US. And so this is actually something that we're starting, maybe this is a reason for this downtrend that we're seeing over the last few weeks. But in terms of the concerns about mutations, there are some. And, will the vaccine prove effective against new mutations? And actually, we've seen similar changes coming like we see with the flu vaccine on a yearly basis. There's, of course, the most important mutation that you're hearing about lately is one from South Africa. You're also hearing one about the UK. And interestingly, they're being studied. Mederna is actually studying a phase 1 trial in South Africa for a booster shot. So after you got the first 2, giving a third, did that improve safety and efficacy for those particular patients? And they also found that the Mederna vaccine actually had a better efficacy against the new UK strain than it did against the original strain. Pfizer actually demonstrated that it could neutralize that particular variant, but they also said that if a new variant came out, they could actually retool their vaccine. The problem is that that takes time and that takes production. It could be within 6 weeks, but then you got to produce the millions of vaccines to get that, which is a difficult issue, something that is faced every year in this country with the flu vaccine. So it's just kind of showing you that they're not going to require new phase 3 vaccines to determine if variants are going to be effective. They'll just use small safety studies. And of course, the Pfizer one demonstrated that key mutation efficacy. Other concerns, does the mutation actually weaken the efficacy? And the short answer is yes, it does. The newest vaccine at GlaxoSmithKline in Oxford actually got suspended in South Africa because they were actually a very low rate of efficacy as compared to the other vaccines. But interestingly, I thought it was more important that they had an 85% efficacy for preventing patients from going to the hospital and being ventilated, which in all honesty is probably the best thing from the healthcare perspective. Of course, it was only 49% effective against that new variant if you're talking about preventing infection. What about pregnancy? Well, all this information, again, is from the CDC, and as you might expect, very few pregnant patients were enrolled on these clinical trials or breastfeeding patients. The general principle is that during pregnancy, vaccines are rarely an issue, but there's very little data, as I mentioned. Messenger RNA vaccines are not thought to be a risk for transmission to infants at all, but pregnant people are encouraged to enroll in the V-Safe, which is a CDC's smartphone app evaluating long-term safety. And there's actually a registry trial that's underway for patients that are pregnant. Key considerations really for the person that is trying to become pregnant, is pregnant, or is breastfeeding is really based on two things. What is your likelihood of exposure to COVID-19? If you are in an ER or work in an ICU, your exposure is going to be much higher risk than the person that works at Walmart. So you're going to have to make that as terms of a choice that's there. The other thing is pregnancy by itself is a higher risk for severe COVID infection complications. So, having that being said, if you are pregnant and then you get COVID-19, you can have much more difficult issues than if you were not. And so the question is, should you get it just in order to prevent you from having further complications during a pregnancy? There are other conditions, autoimmune diseases. The CDC says you can receive the vaccine. Weakened immune system, they say you can receive it, but like we discussed earlier, patients that have that weakened immune system may not have as robust a response to forming the antibodies that actually fight off the infection. Guillain-Barré, which is a very rare ascending paralysis thing that is seen in vaccines, and a couple of vaccines that are the live attenuated ones, state that we haven't seen any cases reported out of that many millions of people that have had the vaccine thus far, and actually state that patients can receive this. Bell's palsy is another thing that is quite common to different medical conditions that are out there. And interestingly, the number of cases are very similar to the known population of cases that we see. So they actually recommend that you could receive it for that. And in the end, what I would just say is I hope that this talk has kind of given you an overview enough to know that maybe you'll not be like this guy where he stopped taking the medicine because he preferred the original disease to the side effects. But instead, I hope it'll allow you to understand that there are some really good data out there that demonstrate this not only works, but is very, very safe. And with that, I'll end and I'll take any questions from anybody.
Thanks, Mike. That was really incredible. We have a lot of people that have joined since we started. So there's a Q&A button at the bottom of your screen that you can use. There's also a chat function. But if you want to use the Q&A, that will allow other people to see as well the questions, if anyone has questions. And again, this will be posted on the share drive, and people that joined in will be able to circle back and see the part that they may have missed, and also others will be able to watch. And so we can also handle questions after this as you think through it and look at it. I really appreciate this, Dr. Williams. This was really incredibly thorough and very, very useful. And I think friends and family are going to be asking us questions, and we're going to have all the answers now. So that's great. Okay, well, I guess we'll wrap it up. I don't see anything in the Q&A right now. And so I really appreciate everybody joining. And again, really do appreciate Dr. Williams so much for doing this. Here we go. I had the one last minute question there. Can we post to our website is the question. That's a good one. Okay, we'll talk about that. Okay, we'll wrap it up. Thanks everybody, and let you get started with your day. Thanks again, Mike.
Yep, take care.